almost 100% of the breakthrough cases that unfortunately died are persons who have had severe comorbid conditions. Stroke survivors, diabetic patients badly controlled, recent heart attacks, etc. So yes, the breakthrough cases, as by definition, are those who are fully vaccinated at least 2 weeks prior, then get COVID. That is still possible. And unfortunately, we see the bad outcomes in persons who have severe multiple comorbid conditions.
That was Dr. Mahendra Carpen, the head of medical services at the Georgetown Public Hospital Corporation. A breakthrough case, according to the U.S. Centers for Disease Control and Prevention, is when a person tests positive for COVID-19 at least 2 weeks after becoming fully vaccinated. Since the administration of the COVID-19 vaccines started earlier this year, they were touted as the best available medical tool that would help protect people from experiencing the more severe and life-threatening symptoms of COVID-19. There have been concerns, however, that these vaccines do not protect people from becoming infected and even getting hospitalized due to the emergence of more severe symptoms. From September 13, the Ministry of Health started to reveal the vaccination status of people who died from COVID-19. Since then, it was reported that 57 patients who had COVID-19 passed away. Of that number, 4 fully vaccinated patients died. Previously, it was reported that 2 other fully vaccinated patients who had COVID-19 had also passed away. The newsroom confirmed that they were both suffering from diabetes and hypertension, in addition to other ailments which all contributed to their death. Dr. Carpen also reminded members of the public that since the beginning of the pandemic, reputable health authorities warned that people with these comorbidities are more vulnerable to the worst effects of COVID-19.
Now, no vaccine ever in the history of mankind has been 100% protective against catching the infection. None. But it is the same thing that we are seeing now with the COVID-19 vaccine. There are breakthrough cases, but more than 95 to 98% of the time, it is protective against those same parameters that I mentioned to you. Admission to the ICU, being put on a ventilator, and dying.
Earlier this year, research by Australia's Griffith University found that cancer, chronic kidney disease, diabetes, and hypertension are the 4 main comorbidities leading to COVID-19 deaths. But Dr. Carpen noted that such findings are not just theoretical information or information relating to patients abroad. It is the reality in Guyana. And so he made the fervent appeal for people to get vaccinated so that they can have their best chance of defense against COVID-19. Reporting for the newsroom, I am Vishani Raghavir.